Hello, students. This is Ms. Brackenkeelis. I am going to continue the lecture that we ended the last time we were together on Tuesday. I'm going to do a series of video recordings to make up for the time that was lost this Thursday due to the presidential series. So the last time we were together, we were going to start, Objective 8. And Objective 8 deals with identifying the components of the vascular supply to the lung. So the vascular supply of the lung is composed of two different areas, and that is the pulmonary and the bronchial circulation. If you were to refer back to your review for Unit 2, we will be in the area of question number, it looks like 39 through 46 for the rest of Unit 2A. Okay, so let's look a little closer at what exactly is the pulmonary circulation. Well, the pulmonary circulation carries mixed venous blood from the tissues through the lungs to restore its oxygen content and remove carbon dioxide. Also, there are a few other terms that we're going to go over, and that will be question number 39 on your review that deals with ventilation, external respiration, internal respiration. Okay. So we've already just learned about what exactly the pulmonary circulation does. Let's take a look at what the bronchial circulation, what does it do? Okay, so the bronchial circulation provides arterial blood to the lungs to meet its metabolic needs. Now it's very interesting how the pulmonary circulation carries venous blood, but notice that the bronchial circulation is the one that carries the arterial blood. So just make a mental note of that. Okay, here are a few more terms that I had mentioned before, and it's also in your review, number 39. The first term is ventilation. Ventilation is the movement of gas into and out of the lungs. So this is our specialty, what we do in respiratory therapy. We ventilate our patients. We make sure they have a breath in and a breath out. And that whole scope of doing that particular procedure is called ventilation, providing ventilation to your patient. External respiration deals with gas exchange in the lung between the alveoli and the pulmonary capillaries. And then the last term we're going to talk about here is internal respiration, and that deals with gas exchange at the cellular level in the tissues and the organs of the body. So those are a few terms to just make a mental note of. You will see these again on your exam for Unit 2, so make sure you memorize that information, or at least be familiarized enough with it that if you was to see it as a question, that you know which one deals with which area. So let's look a little closer at the pulmonary circulation. So the pulmonary circulation originates in the right side of the heart. Really important to know that. And oxygen is depleted. Venous blood is pumped into the lungs. So we're talking about as the blood has already gone through the systemic system, it comes back around because the tissues have already taken what it needed as nutrients to the cells, and it goes back around to the right side heart of the lungs so it can be reoxygenated again. So oxygen is depleted, venous blood is pumped into the lungs by the right ventricle via the pulmonary arteries, which is adjacent to the main stem bronchi. So it's really important to know that when we think of arteries, in this case, only in the lungs, it's venous blood. But when you think of veins, as the circulation comes back, and we're going to learn more about the cardiac circulation in Unit 3, the veins actually carry the arterial blood. So that's kind of interesting how it's a little bit reversed than we would think. But in the systemic system, the arteries carry the oxygenated blood, whereas the veins carry the venous blood. So we don't want to mix those two up. Just know in the lungs, the pulmonary arteries have the venous blood, and the pulmonary veins have the oxygenated blood. So as we're just moving through the pulmonary system, further division into the pulmonary arterioles and into the pulmonary capillary bed. So it starts off in the bigger vessels, and then it goes into the arterioles, and then it goes down to capillary bed, which is the smallest area in that system. And then down there is where the gas exchange takes place. So it's almost like telling you a little story of how the blood flows through the pulmonary system. So once gas exchange has occurred, the oxygenated blood travels back towards the heart through the pulmonary venules, the smaller vessels, the pulmonary veins, which are the bigger vessels, where it reaches the left atrium of the heart. And then the pressures of the pulmonary circulatory system are approximately 1/6 of those in the systemic circulation. So the systemic circulation, after the blood is oxygenated, is pumped out into the arms and the legs and all that, that pressure has to be a lot higher. That's how we have blood pressure, because you need a big pressure to pump it through the whole system. But when you're in the pulmonary system, it's a very low flow, low pressure area. So just make sure you remember that. Always pulmonary, anything that's in the heart area or the pulmonary system is always a lower pressure. So although the cardiac output passes through both the pulmonary and the systemic circulation, the pulmonary circulation offers very low resistance, because the pulmonary circulation is a low pressure, low resistance system. So be sure you remember that, because that is a test question. Always pulmonary, lung, heart, very low flow, low resistance. As we wrap up our story here about the blood flow through the lungs, the pulmonary circulation is a very low pressure system. And I just emphasize that to the end because sometimes students get that mixed up. The blood flow is highly dependent on gravity because it's such a low flow system. So gravity is kind of the thing that helps make it so it flows in and out of those areas. So in a upright lung, meaning if your lung was sitting straight up and down, just like we do in a chair, where the apices are at the top and the bottom of the lung, the bases are at the bottom, the hydrostatic pressure, the pressure within the capillary, decreases 1 centimeter water pressure per centimeter of distance between the base, which is the bottom, and the apex of the lung, which is the top. It's a very low flow system. It's very slow moving because of gravity. And due to this, the base of the lung receives approximately 20 times the perfusion of the apex. So because the base of the lung, it has the help of gravity, it gets all the perfusion, where the upper part of the lung has less pulling on it with the gravity, and it gets less perfusion because of the way the blood flows. So now let's look at that other area we talked about. We said we're going to talk about two areas, the pulmonary circulation and the bronchial circulation. So let's look a little closer at the bronchial circulation. So the bronchial circulation deals with mixed venous blood into the pulmonary arteries. Remember, in the pulmonary system, arteries deals with venous blood. The pulmonary artery lacks sufficient oxygen to meet the metabolic needs of the lungs. A separate arterial supply called the bronchial circulation also accompanies the bronchi. And the metabolic needs of the lungs are low, and the lungs are oxygenated by direct contact with inspired gas. So because of this, the blood flow through the bronchial system is only 1 to 2% of the total cardiac output. Okay. So a single right bronchial artery arises up from the upper intercostal and right subclavian, or the internal mammary artery. And the two bronchial arteries supply the left lung, and they branch directly to the thoracic aorta. So just talking about how everything is fed within the system. So the arterial circulation terminates at the pulmonary capillary bed, down in the area where the gas exchange takes place. You see here in the photo, you can see how the arteries feed the lungs and how they pass around the different vessels. The left carotid artery, left subclavian artery, all of these kind of go through these different areas, and that's how the lungs are fed. Here's another picture. We can kind of see how the arteries go down to the different areas of the tissues near the lung. The arteries right here, you can see there, and the veins there, that brings in takes away the arterial blood, and this one that brings in the venous, and the gas exchange takes place down towards the bottom. Okay. So those different things in Objective 8 covers question 39, 40, 41, and 42. Talking about what is the difference between pulmonary and bronchial circulation. 43 also talks about the pressures that's in the systemic versus the pulmonary circulation, which we covered. And now we're going to also go into the pulmonary lymphatic system. Okay. Objective 9 is describe the purpose and the function of the pulmonary lymphatic system. Well, the lymphatic system, when we're thinking of the definition, consists of a network of lymphatic vessels, lymph nodes, the tonsils, the thymus gland, and the spleen. Lymphatic system primary function is to clear the fluid from the interstitial spaces. We tend to think of the lymphatic system as the plumbing system of the lung area and in that system area. So it's the pumping system. It clears fluid from interstitial spaces. It also has a major role in the body's immune system as well, and it removes bacteria, foreign matter, and cell debris via the lymph system. So things get in there that shouldn't be in there. The lymphatic system is what kind of cleans it up and makes it clear again. So when a person's lymphatic system is affected and they have a lot of swelling and things like that, they can get into a lot of trouble, also even with infection, if their lymph nodes aren't doing the things they should be. Important role of the lymphatic system. So there's lymphatic systems in the body, limbs, and there's lymphatic systems in the pulmonary area as well. So the pulmonary lymphatic system consists of superficial and deep vessels. Superficial or pleural network drains the lung surface and the pleura, and the deep network drains the lung tissue. Be sure that you know that, because that is a test question. The superficial pleural network drains the lung surface and the pleura, and the deep network that drains the lung tissue. The lymphatic system works with phagocyte cells, what we call pulmonary macrophages, in the alveoli to provide a defense against foreign material able to penetrate to the alveolar level. Pulmonary macrophages originate in the alveoli area. So then the lymph fluid returns to the circulatory system through the lymphatic channels, and that course towards the hilum. We know what the hilum is. We discussed that in last class, and these channels join the pleura. So these lymphatic lymph channels travels towards the hilum and accompany the septa of the veins and the arteries. Let's look closer at what is exactly this lymph flow that we're discussing. So the lymph flow is channeled in one or more lymph clustered around the hilum, and from there the lymph travels to the mediastinum, and the lymph rejoins the general circulation by either the thoracic or the right lymphatic duct. So the lymph system has its own circulation. It goes down and it cleans up the different areas. You can see here in this photo how it kind of threads down, and it does this little business there to get out the foreign material, and how it moves, because it's a very low flow system too. It has these little like valves that kind of inch along, almost like the intestines, kind of inches along, opens and close, opens and close. Well, the gravity itself helps that as well, and it opens and closes to kind of remove these debris and matter that should not be there. You can just another illustration here, so you can see how the lymphs kind of thread around the bronchus and the bronchial area, and it goes down around the lungs. You can see how it would be able to clear the fluid and debris that's there that should not be. And then here's that picture we seen earlier, just another illustration of the lymphatic system in the pleural areas. Okay, so this concludes and ends of section A. The next video I will be showing will consist of the upper airway, and that'll be part of section 2B. So look for this video that I'm going to post also on Canvas for section 2B. Have a good day.